Good evening, everybody. Thank you for joining us. I'm Dr. Arkady with Rebalance, and today we have a very intimately interesting topic. And if some of you who follow our channel, you know that our topics are generally intimately interesting. Nevertheless, this topic is very interesting because, quite honestly, I will be myself very interested in hearing what our guest had been practicing and is willing to teach other people to do in the space of not only sexual wellness but specifically men's aesthetic and wellness and sexual wellness. And of course, Dr. Natalia, who is many of you know as well. She is a teacher, she is a physician, a functional medicine specialist, aesthetic specialist, and she will be facilitating this interview. And I'm sure she has many, many interesting questions from the female side. Nevertheless, I was just discussing with Dr. Asminkin, who'd been practicing aesthetics and sexual wellness for many, many years, primarily in Europe. And now he has his presence and practice in the United States. Uh, Certain things that we have been doing in our practice to enhance and improve men's sexuality and give back all of us guys a joy of having healthy erection, having much better intimacy at home, and certain things that he's been practicing, I quite honestly never heard of. So, which is amazing, and I cannot wait to hear what he can bring to the table. So, Natalia, please, you have many questions to ask.
Yes. Hi. Thank you, Dr. Lipnitsky. Welcome, everybody, for whoever joined us. It is going to be an interesting webinar. Our guest speaker is Dr. Vitaly Sminkin, who is traveling right now from Europe to United States. And his specialty is, aside from aesthetic, he specialized in sexual wellness and rejuvenation in the sexual wellness arena. So a lot of accolades for Dr. Sminking, and we were excited to invite him to our webinar. Dr. Sminking speaks mostly Russian, a little bit of English, he understands. So he would be speaking Russian and we will be translating. You could turn on the captions as well for translations, and we will send everybody a recap of webinar with audio translations as well. For those of you who do not understand well Russian, we will get that information forward as well. So Dr. Sminkin, thank you very much for joining us. And I would like to introduce you, ask you some questions in regards to, it's an interesting field, it's a revolving field. So tell us a little bit of how did you get involved with intimate rejuvenation? We heard of skin rejuvenation and other things, but to the extent intimate rejuvenation that it's getting popular, tell us a little bit more. How did it happen? What brought you in? Your success stories. We're going to discuss more in detail, but tell us a little bit. How did it all start?
I've been in my profession for about 18 years, working in aesthetic and anti-aging medicine. The last 8 years, I've been focusing on intimate rejuvenation. Accordingly, there is a high demand from patients who want to improve not only their health, but also their appearance. And when everything is perfect for a patient, they want to continue perfecting their body. Accordingly, with age, our stimulation, or rather collagen production, decreases and doesn't produce as much anymore. Consequently, we need to treat both face and body to stimulate collagen production. There is a large demand from male patients, as well as female, to improve their skin quality. Lately, I have been getting requests from men who also want to increase their penis diameter. Following all these daily patient requests, I decided to undergo training. And 8 years ago, I studied penile enhancement procedures using polylactic acid fillers in South Korea. I underwent a lot of different training in this field. In Brazil, I also trained with plastic surgeons in fat implantation into the penis and other body areas. After trying all technical methods, I saw the best results and prefer to use polylactic acid because it gives the best results with minimal side effects. While any procedure requires rehabilitation, treatment with polylactic acid fillers has the least amount of downtime. An application is quite fast and safe compared to other procedures. So, let me tell you more details about the difference, the advantages, and why specifically. After trying procedures with polylactic acid once, why does the patient keep coming back to have this procedure done again? All those patients who have received hyaluronic acid fillers treatments before, they understand and love the difference in quality and sensations. I had clients who came in and had hyaluronic acid fillers done before recently. We first remove and dissolve these HA fillers with medications, and then do the treatment with polylactic fillers.
Yes, thank you very much for answering that question. Once you started to offer it in your practice, did you see a big difference in patient flow, or did you see any changes? Is there interest in this arena?
How ready are patients for these procedures if there is demand? And has anything changed in your practice when you started doing these procedures?
Yes, of course. As I mentioned, there is very high demand from women too, and some men are still shy about this procedure. But at least when they learn about it from friends or acquaintances that this treatment exists, usually they learn about it from the press or social media. Then they ask questions like, "Do you perform these procedures?" So during our training class, we teach our students how to communicate with patients on this intimate and sensitive topic, how to approach different types of patients and explain things, maybe even how to start the conversation subtly. For example, you could say, "I, as a doctor, also perform this procedure." And accordingly, even if patients don't ask questions right away, at least it stays in their mind, and they ask about it later, sometimes after several months, sometimes after a year. In my practice, there are women, wives, who have given this as a birthday gift to their husbands. Well, I understand they did it for themselves too when they brought their husbands for penis enlargement procedure, because they all had different experiences with first husbands, second husbands, and they feel the difference. One of the patients said, "My previous husband had a very good penis diameter, meaning it was thick, but with my current one, in a private conversation, it's not enough for me. Everything else is good between us." I want to add the sensations that were there before because I enjoy the actual intercourse itself. But we don't want to use toys. Because of this, patients are very grateful. Both men and women are very satisfied naturally, as this is a very specifically targeted procedure. Not every specialist wants to perform this treatment. Yes, maybe they're not psychologically ready. But you need to prepare properly, and in reality, it's a very simple procedure. And if there's no squeamishness, like with gynecologists, urologists, for example, among doctors, then it will bring very good income because it's a very good, profitable procedure. There's a lot of positive feedback from patients, and it's the same thing for the patients. We need to change the patient's psychology. And the approach, which we do in our consultations and training, I explain that it's the same as lip augmentation. That is, as we age, we lose volume and collagen everywhere in our body, including in our penis. A sponge, it becomes smaller, the volume decreases, and erection filling becomes less collagen is being produced, decreasing the penis size. So, by doing treatment with polylactic acid, we stimulate collagen building very effectively, specifically collagen stimulation.
In our practice, we see how Dr. Lipnitsky treats erection problems, and the question often comes up, and Dr. Lipnitsky will explain and tell us about the questions, help with erection, and help us if it is possible to change the size of the penis. And this question has been asked more than once on our YouTube channel. We see how people write, and when they write their reviews, or some questions. And I know that you also use shockwave therapy in combination with PRP. And Dr. Lipnitsky can tell a little about how shockwave therapy works.
I'm discussing help of or using treatments in combination with shockwave therapy for erection. And we do hear a lot from our patients that they, once we help them to obtain the erection, do we have any methods to help them to change the size or to change the circumference? It's a common question that we receive. And that's going to be a good addition to our practice as well, to offer it as part of the treatment protocol. And I know Dr. Sminkin uses shockwave together with offering polylactic acid fillers. And Dr. Lipnitsky, with the shockwave, tell us what your expertise and what we offer and what results we get. So we kind of offer combined treatments to the patients to get the best results.
Sure. So years ago, when we set to create a program, and just like Doctor said, there's a huge necessity in it. A lot of people asking for it. Again, being in the functional medicine space, treating different chronic conditions as holistically as possible, as naturally as possible, we understand the side effects and impact of medication, the standard of medical care on the erection long term. And we were set to create a program that can repair the erection and return back the girth, the size, the natural girth, the natural size of the penis by revascularizing the tissue, bringing back a healthier muscle activity, improving the function of the pelvic floor, as well as the resupplying the body with certain supplements that are designed to enhance the vasodilation, enhance the opening of the blood vessels in a holistic way, naturally, just by building up a proper nitric oxides level in the body and improving the venous activity. So we are using a very specific protocol that we created, combining the extracorporeal shockwave therapy. As a matter of fact, we're using both types of shockwave, radial and focused, specifically to influence every part of the tissue, every type of the vascular system, capillaries, veins, and arteries, deeper and more peripheral ones, to repair the network of capillaries, which often is significantly diminishes with age, and to improve and reduce the atherosclerotic changes that occur in the larger vessels, arteries, and veins. Therefore, and we have amazing success with that, but people do ask, as a matter of fact, is there anything else that we can do to enhance the size of the penis if certain people are just unhappy with the general anatomical size of the penis, and of course that happens quite often. The type of tool that I really love for home use, and we often recommend to all our patients as almost a physical therapy for the penis, are vacuum pumps, very specific vacuum pumps, manual pumps that help to re-stretch the tissue, enhance the collagen activity, of course, as well as to improve the vascular activity. And a lot of people saying, yes, it actually helps with the size as well. I was always very skeptical of using fillers specifically, and I would like Dr. to touch based on that, because I felt that most of the patients we see already have erectile changes, erectile problems, dysfunction, and it will suppress, in fact, a vascular activity of the capillary network that is already not working well. And I guess I'm talking more of the fillers that either don't dissolve or redeposit the fat in the penis, as well as the hyaluronic acid, which dissolves extremely slow and can in fact suppress the blood vessels. But apparently, our experience is not as great as doctor's experience in this particular treatments. And I would love him to answer these questions: how exactly the performance, the fillers and enhancement of the size not diminishing the performance, but in fact enhances the performance. And I'm definitely eager to add that to our protocol if this is really such an a great improvement.
The
question is there a difference between lactic acid and hyaluronic acid? We have seen patients who have had the procedure with hyaluronic acid. If they have problems with erection, it got worse only because there is the weight of the fillers themselves. And were there any results with which the patient was not satisfied? I know that with lactic acid this will not happen because there is no such volume. It is more natural. I wanted you to tell us. Ready to take the next step? Don't wait. Click the link in the description to find out the next course start date and follow us on social media for updates.
I'm actually curious to know, using fillers that were used before, that don't dissolve and stay there for years, right? Or fat transplantation like hyaluronic acid, how did it affect people on capillaries, a system that's already not working well? And were there people whose erection got worse? That is, volume is good if we add it, but if we also improve the erection at the same time and don't make it worse, that's great. And so I would like to ask you, tell me the difference between the fillers that were used before and some people use them now, and what you do and how it works directly to improve or worsen the erection.
So, I'll explain the difference regarding using polylactic acids and other products for enlargement of the penis. For example, in the past, HA fillers and silicone were used. The effect from them is that there's some degree of increased circumference, but it is not firm and very soft. The skin quality of the penis, it's very thin. So hyaluronic acid fillers and silicone become uneven and loose under the skin. Regarding fat transfer, fat processing is now much better in structure. Specifically, they make it into homogeneous emulsion. But there are certain issues with fat grafting. When it doesn't take well in patients, it all becomes very uneven and clumpy. For instance, those who have an active sex life, implanted fat sometimes shift, migrate, and as a result, it becomes completely lumpy. You don't see such an occurrence with fat injection into the buttocks, breast, and face. Regarding what was more popular recently and is now less so, it's hyaluronic acid fillers. When injected subcutaneously into the penis shaft, it provides volume. But there's a significant psychological aspect here. For the patient, in a relaxed state, without an erection, it looks good in underwear and maybe visually. But regarding sensations, for the patient it feels that it's very soft, like a condom filled with water. It feels unnatural. During erection, the shaft gets erect internally. But all this material is on top. And during intercourse, it all kind of moves around back and forth. And for female patients, psychologically and sensation-wise, it doesn't feel like a firm erection. It makes them feel, both psychologically and physically, that he has problems with erection, even though young patients might not actually have any such issues. Because of this, there is a side effect. The effect of hyaluronic acid fillers specifically is like that. It's voluminous, but not firm. There's no firmness, and also migration occurs. In my training, I show how patients came to me for fillers after polylactic acid, but they had large amounts of hyaluronic acid fillers injected. and the filler migrated, creating very strong asymmetry from one side to the other. So, first I removed all of this hyaluronic acid filler, then did the polylactic acid fillers instead. During our training, I explain in details how to dissolve and remove previous fillers, and then we proceed with polylactic acid filler treatment. Regarding polylactic acid, since this is collagen stimulation naturally, it may have minor swelling for up to a week, but not as much as from hyaluronic acid. And because of this, physiologically we get 21 days of collagen stimulation. Due to collagen stimulation, penis becomes firm in any state. You can calmly stretch it, pull it. When a patient comes in, you will never see that something was done, that the penis was enhanced. Unlike hyaluronic acid, which can be felt by hand under the skin, with polylactic acid, when the procedure is done properly, in a relaxed state, no one will know that anything was done. Polylactic acid filler creates a natural thick penis diameter. That is, this is advantageous and naturally doesn't affect erection in any way. The skin color doesn't change at all. Regarding vasculature, essentially, if veins were aesthetically visible before, that is, capillaries, they'll remain the same. Maybe only the capillary network might be slightly more visible for a month while the product is being absorbed, but it doesn't affect erection in any way. There are injection techniques for large volumes as well, and special techniques for patients who have premature ejaculation and finish quickly, who want to have a very prolonged intercourse. There is a techniques for injecting acid into the penis head to reduce sensitivity. But in my experience, according to patient feedback, intercourse after polylactic acid treatment remains the same, but due to the emotional aspect, it lasts longer because both partners and women are very satisfied, meaning they get pleasure. Today we have two of my patients with us, one man who can share his experience, and a woman. She can tell a couple of stories from her friends, not just media stories. Because of this, she asked for permission, and she's very open. She can describe everything in more detail because she knows those men personally.
I wanted to say, it's just like a joke. Since collagen was produced, wrinkles are removed too, right?
Of course, about the skin quality. That is, the combination of procedures is very important. Polylactic acid fillers, shockwave therapy, or lasers with specific techniques. We improve skin quality, we help stimulate collagen even better after polylactic acid. With these combinations, that work even more effectively for skin quality and thickness of the penis. If we take men who are 50 to 60 plus, we can indeed achieve, not with one procedure, but with several procedures, the penile skin quality of a 30-year-old man.
Yeah, it's like a positive side effect.
Natalia, I have a couple more quick questions. The doctor reveals more and more interesting topics. And two quick questions. The first is from my practice. We have patients who had procedures with fillers 5, 6, 7 years ago. Also, hyaluronic acid and fat transplantation, who say that sensitivity has decreased and it is much more difficult for them to finish sexual intercourse. That is, does the filler that you use affect or can negatively affect sensitivity? And the second question is about fillers in the scrotum. Do you do it? Do you use the same techniques or Botox? Because many people are also interested in the scrotum changing with age. The testicles look completely different, and everyone wants to look younger from all sides. Therefore, if you can say a few words about this, that would also be great.
Excellent. Basically, I'm asking doctor from my experience with certain patients that we have been reporting after fillers in the past using some hyaluronic acid, some fat fillers. They had not only certain issues with erectile strength, but also with the sensitivity. And I was asking the doctor if the fillers he's using, if he had any reports from patients that they had significantly reduction sensitivity that would have basically make it challenging for them to ejaculate. At the same time, I also would like to know techniques that he's using as well as the fillers or Botox to treat specifically the changes around the testicles and testicular sac that often changes, of course, skin changes with age, and a lot of men would like to rejuvenate that area as well.
With small injections of fat into the penis and hyaluronic acid, if we're talking about the shaft, sensations might decrease slightly if they were injected. That is, there's a special protocol for patients who experience premature ejaculation. Then it's injected. The emphasis is specifically made on the penis head to reduce sensitivity. If a patient comes with the goal of wanting to change the anatomy to make a beautiful shape, make the head longer, or like a mushroom cap, then, naturally, we warn the patient that sensitivity will decrease, and possibly intercourse will last longer because he won't be able to finish quickly, not just quickly, but even taking longer to finish. We warn about this. That is, if a patient came with a request, we did the diameter for him. The diameter is bigger. The volume is very good. Now, if he wants the head enhanced, here we need proper patient selection. We warn him that if we do this, sensitivity will decrease. But when we work on the penis shaft with polylactic acid, since there isn't such a cushion in the form of fatty tissue and acid layers, the sensitivity doesn't change, as polylactic acid doesn't affect sensitivity specifically. And regarding the Botox injections for the scrotum, there are different techniques for injection, though larger injections aren't so relevant because it's a rare request. That is, theoretically and physiologically we can do it, if requests come from patients. If someone wants aesthetic changes and has some sexual fantasies, or possibly it's related to their work in the adult film industry, then Botox is injected into the scrotum to make them more, so to speak, to make the scrotum more suspended, and the testicles not so pressed against the penis, but more hanging towards the pelvis. That is, to make it more, so to speak, like garlands now during our Christmas season. There are protocol techniques where a special cocktail is mixed together with Botox. That is, a cocktail is made from vitamins, amino acids, and it's done together with Botox, a low concentration, and then it turns out that we improve skin quality and hydration, making the scrotum look less wrinkly as well. And if, let's say, they're normal size, but they're very tight, we also warn the patient that if he really wants it, we are physiologically disrupting thermoregulation, because these are protective functions, meaning everything is good in moderation, and it should be safe. If we've done enough aesthetically, and the patient comes and says, "I want more," Yes, to make it even more. If he has such a fetish, or his partner has such a fetish, then here we say that there will be disruption and there could be disruption of sperm function, disruption of temperature regulation. That is, we don't forget about patient's health.
Yes, to make it safe.
Of course, yes, yes, yes. And aesthetically, we can solve many problems. Our patient is ready now to share his feedback. We could ask him sensation during the procedure itself.
Давайте, если let's we have a patient that's joining us. He agreed to join us because this is such a sensitive topic. Not a lot of people want to talk about it, but he was nice enough. That's one of the Dr. Sminsky's patients. So he would be joining us to tell his story, what his experience was, what he felt, and he has positive things to say about this procedure.
I'll briefly tell you about the patient. This patient had a polylactic acid procedure with me about 4 years ago. And he's going to tell us about his experience, about male psychology. That is, we can now ask him questions, and all questions will be in the chat, and he will answer them. And what will be interesting for our colleagues is to learn about his experience, as he should be coming out now.
Может быть, пока он подключается, вы мне зададите вопросы, чтобы...
It's okay. My next question is, when you start offering these procedures, how did the practice change? How long does it take to perform the procedure? Cost for the procedure, payments, what are people willing to pay for it? Это значит, ну, это получается каждый врач...
Every doctor asks himself the question, if I do a new procedure in practice, what do I get out of it? How much can I earn? What consumables will I have for this procedure? How often can I do this procedure? Well, tell me a little from the practice side. How does this affect practice in general?
In practice, this is valuable among colleagues. Naturally, it greatly enhances your professional growth because you reach a new level of procedures. And at the moment, this is such a narrow specialization, but it's becoming more and more popular. The procedure takes 30 minutes, and in 30 minutes, you earn with one procedure a minimum $5,000 with the cost of one vial of Sculptra. How much does this procedure cost? That is, basically $5,000 for 30 minutes. If patients come to you with a quite large penis length or, say, an African American patient, that is, someone who genetically has a very long but thin penis, naturally, you can use 2 vials of Sculptra in one procedure. So that's from $10,000 accordingly. That means in 30 minutes, well, maximum an hour, you earn $10,000. If you look at aesthetic medicine, that is, this is quite a very good profit. And when patients start to feel the effect, telling friends at the gym, at the salon, at the pool, and share, naturally, you get patients coming for the procedure, a different level of patients. And these patients, when they come for procedures at such a cost, they rarely ask any questions. When those patients who come, let's say, for Botox or lips, the more expensive the procedure, the more conscious the person is, the more calmly they may relate to money. And they're already confident inside. That is, this is a patient who will pay, or patients who are already much more confident. And this procedure really increases your level of professionalism and your professional self-esteem. Because, well, few people do this. Accordingly, here the professional growth is quite high. Even among a certain circle of people, they already talk nicely. Like, I know such a doctor through word of mouth. This is a cool doctor. He does such procedures. So it turns out to be like an exclusive club of patients.
I think our
Пациент подключился.
как его зовут?
Илья. Здравствуй.
Hello. I'll ask you a few questions. I mentioned that we did the procedure together about 4 years ago. Please tell us how you came to want this procedure. What motivated you? Was this specifically your first question?
Что тебя подвигло? Именно был ли, именно вот этот первый вопрос.
Хорошо. Подвигло меня...
Let's say, well, what motivated me for this procedure was that
Стало интересно вообще
I became curious about whether there would be any difference in intimate life,
в интимной жизни. Поднимет ли
whether it
мой
would boost my self-esteem as a man.
мужчины. И... но мне
And I
кажется,
think
это
it's great
очень
during this period to understand whether a large penis or small one is worth it.
а, стоит ли большой хуй или маленький.
Okay. Tell us- Please tell us when you were going for the procedure, was there any fear, doubts about the procedure itself? How painful was it for you? Was there much swelling?
Был ли большой отек?
Ready to take the next step? Don't wait. Click the link in the description to find out the next course start date and follow us on social media for updates.
Да, было очень
Yes,
много сомнений.
there were a lot of doubts about the procedure. I was very scared because injections in intimate areas, I couldn't imagine how it was possible, and I thought it would be very painful.
Будет очень больно.
Because of this, there were many doubts. There was no one to discuss it with because I was afraid to tell my friends. I was very embarrassed about how they would react if I went. The procedure itself was surprisingly painless, like being bitten by mosquitoes. It took very little time, half an hour, maybe even less. And I expected it would be some super complicated operation and very difficult, which you need to prepare yourself for and approach carefully. In the end, everything turned out to be very simple, like a regular visit to a cosmetologist, you could say.
Сколько у тебя...
How long did the swelling last for?
I had swelling for the first 3 days, swelling and bruising. I was even wondering if it would stay like that or not. But after 3 days, the swelling started to go down, and bruises started to fade, and my sexual organ began to take on more beautiful contours, you could say, more attractive.
Привлекательное.
The effect itself lasted around a year and a half. I thought that after about a year, the effect was something that, was decreasing.
Уменьшалось.
Мгм. А расскажи, через сколько ты
Tell
уже
us, how long did it take before you tried it out in action?
именно пенис?
Через неделю.
After a week, my girlfriend came who I hadn't told anything to.
Сказал. Вот, это был тоже мой эксперимент.
This was also my experiment, whether she would feel the difference or not. When she did feel it, she asked, "What is this? Is it like we haven't had sex for a long time? Was it always like this?"
Ну, нет, я сделал.
Until I said I had some procedures done. It was cool, and I liked the sensations too.
Мне тоже по ощущениям понравилось.
А расскажи, пожалуйста, по поводу...
Please tell us regarding your sensations. To what extent did it affect your sensation in the penis or not?
Повлияло или нет?
Но по моим ощущениям, мне повлияло.
But from my sensations, it affected me in a better way in terms that I didn't have hypersensitivity.
Чувствительности, наоборот, она как бы...
On the contrary, it was like intercourse lasted longer.
Вот. И для меня
And for me, this is a plus,
мне это
and I liked it.
Окей.
Okay, Natalia, do you have any additional questions to ask our guest?
Но вопрос такого типа...
Questions of this type. If the swelling was only 3 days, and after a week you could feel the effect. When you felt the difference, after a week you can see the full effect, or does it get better after a week?
Становится лучше.
Через сколько ты вот именно увидел...
After how long did you see, let's say, the more final result, when all the swelling and bruising went down? We understand you had intercourse after a week, but what about after a month and a half?
When the outlines became more clear, the contours became more visible. I think that after a week, I started to understand that this effect was kind of working. And then it was hard to analyze because you see it every day in the shower. And well, you could say that after about 2 weeks to a month, it had already completely become like this. I had issues at first because I dove into ice water, didn't follow the recommendations that you gave me, and I swimmed in the ice cold water. I ended up having some complications like lumps because of that.
Yes, yes, yes. We had some complications, and since Ilya practices in cold water, he had a small lump develop at the site where the polylactic acid was injected. This is exactly the effect that can happen when there are cold procedures. The polylactic acid, when it hasn't yet been distributed over the course of a month while it's still working, can cause lumps. But in this case, we incorporate shockwave therapy, which is what we did with Ilya, to remove these lumps. And basically, we had a couple of procedures.
We had 2 procedures. And after these procedures, I finally understood the complete outline, the full visual appearance of my penis, you could say.
Thank you. Natalia, do you have any additional questions?
Нет, на данный момент пока вопросов нету. Спасибо большое, Илья, что подсоединились. Thank you very much for joining us and sharing your
Thank you.
experience.
Thank you.
Good luck to you.
Thank you too.
Окей,
Bye.
Thank you very much for inviting him. Спасибо большое, что пригласили. Когда
Meanwhile, I just have a quick question to ask. Доктор, еще быстрый вопрос, хотел,
Да.
пока у Натальи наладится связь. You mentioned many times the laser, and actually very interested. What exactly, I mean, I guess what kind of laser you use and what type of procedures you do with the laser, what they done for, what the expectations are.
A question about the laser. You just talked about the laser several times. I'm interested in knowing a little more details. What is the laser used for? What kind of laser? In what cases is it used? Can you tell us a little about this?
Yes, I use micropulse technology. This is aerolase laser technology. It's available in America, Europe, and other countries. It has 3,670 protocols. Accordingly, there are certain protocols there. I won't go deep into the laser. I'll talk about the technology itself. That is, I have a protocol, and there is this micropulse technology. That heats up the skin UPTO 3 millimeters deep. It is a contactless laser. That laser beam penetrates the skin 2 to 3 millimeters, which stimulates collagen production, improves tissue function, and rehabilitation. So I also do this after surgery. That is, to remove hematomas, reduce them, specifically the protocol and treatment in working with the penis. I first do polylactic acid filler treatments, and after 5 days, maximum after a week or 2, I prescribe 2 to 3 procedures with the laser to enhance the effect. So we have a good tool. This is this laser. I've just been working with it for many years, and I've developed my own protocols from established methods for the face. When using polylactic acid, this laser after surgery. When surgeons refer patients here, it works very well after polylactic acid injections, in the penis area, somewhere after a week or 10 days, to invite them either for this laser or for shockwave therapy, because this will improve rehabilitation, like with this patient. If patients don't follow the recommendations after the procedure and develop different side effects such as lumps, these treatments with laser or a shockwave therapy is a must to help get rid of these complications. If there are no complications present, then these treatments will simply enhance the work of the polylactic acid itself, so that the polylactic acid breaks down and stimulates collagen everywhere. That is specifically the combination of methods.
Спасибо, thank you. Natalia,
Да,
are you
слышно
back
меня?
with us?
Can
Okay,
you
much
guys
better.
hear? Okay,
Yes, much
sorry, I
better.
don't know what's going on with the internet. I wanted to ask Dr. We're excited to hear all of this. It is a new treatment, and I think it has a good potential and good future. I wanted to find out, when are you coming to New York? When are you planning to train us, and when are you planning to share your information?
When are you coming, and when will you teach us all?
I'm planning to be in New York. It turns out on the 22nd. Yes, we looked at the 22nd to the 23rd. We'll coordinate after this. I can say that at the training seminar, what each student will receive, most importantly, is an individualized approach. I will talk about anatomy and physiology, and here I will show before and after photos. Results: if a patient comes with natural asymmetry, specifically during erection, how can we help patients? That is, we will look at the penis as an object of art. When you look at sculpture, let's say, like Leonardo da Vinci, that is, if a patient specifically wants this request, we can handle any aesthetic task regarding diameter, right? That is, regarding anatomy. Because there is a shaft, it goes straight then narrows, or conversely, has a larger diameter at the end. From the beginning. Now we can solve any aesthetic task, as you heard. And in the answers and questions, we can talk about specifically working with the scrotum. So this is a separate niche, right, regarding the head of the penis. And about skin quality, that is, specific procedures, even about whitening the skin in the area, if we're talking about that. But most importantly, at the training seminar, we learn how to properly collect patient history, their chronic diseases, autoimmune diseases, so that we have a very good patient outcome. And I'll say again, after how long the procedure can be repeated. Because patients, having done the procedure once, they ask when it can be repeated, they want to do it again. That is, specifically all time intervals, and how specifically to maintain shock therapy for the patient, and prescribe things so that they feel this approach, care, and work. The same as with the face, right? We don't just inject the patient, do something, but we see them for life. The same with penis enhancement. That is, we will maintain, as with the upper part of the face too, also with the lower part, aesthetically. And accordingly, during the training. We will discuss at the training all details, nuances, specifics, and most importantly, hands-on techniques. We will have models and discuss how to work with a patient if they don't have an erection, how to help psychologically when you need to leave them alone with a phone, with some stimulating videos, how to better position and relax the patient, how to effectively work with different psychological types of patients. If they are nervous, shy, or conversely, too emotional. That is, I explain everything in training. Because of many years of experience with different age groups and ethnic groups, and many celebrities who are afraid that this will be known from video or even just being in the clinic. That is, how specifically to approach and work with different types of patients. Because most patients who come for this procedure are embarrassed. They don't want anyone to know. Here, for example, Ilya as an example. He's a self-sufficient young man, meaning he doesn't care about others' opinions. He's young, energetic, has lots of testosterone, and everything is excellent with him. If there are patients with many fears or some problems, naturally, you need to properly prepare and approach these patients.
And here we have a couple of questions from the audience.
A couple of questions from the audience. I guess questions would be how often procedure needs to be done.
How often is the procedure done? Is anesthesia used during the procedure?
Do we numb patients during the anesthesia? And we're using sculpture. We already mentioned that. It was one of the questions. What polylactic acid we're using only sculpture, FDA approved in the United States. Это скульптура, которая используется для процедуры. И, ну, пару вопросов,
Well, a couple of questions about the procedure itself, but we will probably discuss all these details in the class itself at the seminar.
На самом деле процедура
In reality, the procedure is quite easy.
Если пациент
If a
очень
patient is very sensitive,
тогда
then we first apply topical anesthetic.
анестезию. А так у большинства пациентов не требуется аппликационная анестезия на место вкола. Мы делаем лидокаин, убистезин, то, что как бы доктор обычно
Then, if needed, a lidocaine numbing injection is applied at the site of the cannula insertion. That is, one small injection. In 5 to 10 minutes, the patient is ready to start the procedure.
5-10 минут ждем. Все, мы заранее приготавливаем препарат.
We prepare everything in advance. The polylactic filler needs to be dissolved in advance. In reality, the patient doesn't feel any sensitivity. When we inject into a specific layer, the patient feels comfortable, and it's very, very easy, as Ilya told us. By the way, Anastasia will soon join us and tell us about her experience.
Okay. The question is, if they can come to December, if there is a possibility to get to the seminar in January. I know you said that you will come back in January.
Yes, the January class will be on January 19th.
Да, ну,
Probably not everyone will be able to this Sunday. There are a few days left. Some have plans.
I will send everybody a link with the class description and everything else after the webinar. So if anybody's interested, you could register there. And more questions are coming for.
By the way, in training, I specifically explain how we can create a visualization of the penis for the patient. That is, if a patient doesn't understand how it will be, they can send us a photo, and we will make a visual, like in Photoshop, before and after, what to expect. And that's it. That is, psychologically, this really motivates the patient to do the procedure.
The most important question is probably how much the volume increases. And is there any? I think the answer to this question is no. But is there any effect on reproductive function?
And about size, about diameter, everything depends on the length and volume of the preparation. Naturally, we can increase up to 1.5 to 2 centimeters, sometimes up to 2.5 at once, depending on the length. But we look specifically at the tissue, age, and size. Because of this, we make a specific dilution of the preparation. And everything is naturally individualized. When there's stimulation, when, let's say, it's good, and rehabilitation proceeds quite quickly and well. Briefly, because when we're looking at patients around 30 years old, if we take older patients, let's say 50, and those who already have some chronic diseases, degree of dysfunction, we can still do this. But it needs to be taken into account. And because of this, naturally, we won't immediately use a large amount of preparation. For example, taking 2 vials for a 15-centimeter penis. Naturally, we just do a course of procedures. We did, let's say, 1 vial, 10 milliliters of preparation. We observe the patient and could offer a shockwave therapy, or even if the specialist doesn't have any of these procedures. They can prescribe photobiomodulation, that is, LED light therapy, even yellow light. It will enhance regeneration, reduce swelling. I explain all this in training, and physiologically we can do a repeat procedure after 1.5 to 2 months. There are different protocols, but in principle, we gather the patient's medical history here. If a patient, for example, has a medical problem and is on medications, let's say thyroid problems, then we look at when we will schedule a procedure for this patient, after 1.5 months, or even better, after 3 to 4 months. It's very individual for each specific age group. various diseases.
возрастную группу и различные заболевания. Я это все рассказываю на
I
обучении.
explain in
Мы
training,
именно всё
we will
сразу.
specifically say
На
everything, and
репродуктивную
regarding
функцию
reproductive
это никак не
function,
влияет.
this doesn't affect it
Мы
at all.
затрагиваем.
This procedure doesn't affect the
Возможно, у нас
reproductive
будет в
function at
следующем
all.
году обучение
And
по
possibly, next year we will have
гормонам.
training on bioidentical hormones, if it's necessary to specifically help with conception. Then we will discuss it during this training. But that's already studying endocrinology, that's bio, pellets. But that's separate. By the way, there is one bio pellet called TAD. That is, by chemical formula, it's similar to tadalafil, which improves microcirculation in the small pelvis, more blood flow and stronger erection. Usually, patients specifically combine these procedures. But those who have been coming to me for many years and taking hormone therapy, naturally they do the penis enlargement procedure, because this is already an improvement in health, in quality. So it doesn't affect reproductive function at all. If we're talking about Botox, the scrotum area, then yes. With sperm maturation, it will be worse. Then we negatively affect reproduction. But with polylactic acid specifically, we have no problems and complications, and so to speak, we have no limitations.
Ограничений у нас нету.
Спасибо. Следующий вопрос.
Next question. How quickly after training can doctors perform these procedures in their clinic? And what equipment is needed for this? Ready to take the next step? Don't wait. Click the link in the description to find out the next course start date and follow us on social media for updates.
How soon they could start using this treatments, incorporate in their practice, and what equipment do they need?
Actually, everything is standard. What you already have in your office, in the clinic, topical anesthesia, for example. During the training, we explain everything. What supplies needed, what products used, concentration and dilution of the filler, and much more. Everyone will have an opportunity to assess and inspect the penis on a live model. Everyone will feel specifically the injection zone. I will teach certain techniques so that the patient doesn't feel anything, so that the physician, doctor, nurse aren't afraid and worried about injecting. And of course, after training, they can go do the procedure the next day. In training, we also discuss how to communicate and explain this procedure to the patient, what should be a follow-up procedure for the patient, and much more. If any questions arise after the training, I support all students. But the training will be so informative that questions don't arise. I explain everything so comprehensively, with all the aspects of side effects, complications that you may never encounter, but you should know about. I will explain everything in details during the training.
One more question. Any contraindication for the procedure? Какие-то противопоказания процедуры?
Contraindications include the presence of infection in the area. That is, sexually transmitted diseases, cold-related illnesses. If there's fever, then we won't perform any treatment.
Пациент переходит с одних препаратов на другие, если мы говорим про эндокринную систему. Холодовые процедуры, как я говорил, то есть, в принципе, противопоказаний таких особых нету. Здесь должен...
Here, the patient should be psychologically ready for the procedure. And for them to be ready, we need to build proper communication with the patient, explain clearly, and they won't have fear and doubts. About all patient selection, all limitations, I explain everything in training. But usually for any patient, we just collect a brief medical history and do an examination before the procedure.
I think we're done with the questions, Dr. Lipnitsky, unless you have a question.
Sorry, my mic was off. No, everything was really detailed. Thank you so much. I learned quite a bit, and looking forward to meet with you in person and learn significantly more. So thank you so much for your time. Спасибо большое. Надеюсь,
I hope to see you soon, and we are waiting to learn something very new and interesting from you.
Да, будет
Yes,
очень
this is very
интересно.
interesting. See you
Очень
soon.
скоро.
Well, thank you very much for everybody for attending. And thank you, Dr. Sminkin, for joining us. Спасибо большое.
Спасибо всем
До встречи.
коллегам.
До свидания.
Все, до встречи. Хорошего вечера.